Our founding principles are to provide a safe, accessible, and inclusive place for individuals in our community that have specialized needs to achieve their health goals. We strive for individuals to be happy, healthy, and independent. We have touched more than 2,000 individuals through the years. Every day, I see us changing somebody's life. When you go to PT school, you really learn all the great things we can do to help people get better. Evidence shows that if we keep working with them and we get them stronger, get them walking, keep them moving, they'll get better and better with their diagnosis for many years. I became frustrated early in my career about the fact that we were really guided more by how insurance paid versus really what we could do for patients. There needed to be a place in Rochester and Southeast Minnesota for individuals to go to be able to continue the rehabilitation journey. And so I came up with an idea one day. It just came to me after going to some conferences and seeing what else was happening out there in the world, that there were centers where people could go to continue their therapy. And they were designed specifically with rehabilitation in mind, special equipment, special staff that were trained to help people get better, and it worked outside of a traditional insurance model. And I decided I wanted to do that. So I started ExercisAbilities. We do have a pediatric focused program, and it has grown incredibly quickly. In fact, we're looking at advancing into some new space and really excited about that.
I love the pediatric stories of our PEDS program, and kids that were nonverbal work with our speech therapists and now they're verbal, and to see their parents be able to say what a difference that's making in their child's life, I think is amazing.
And then we transition young adults into our adult program, and there they can stay for life in our program. As long as they have goals that they want help achieving, we're here to help them achieve.
I think physical therapy is what we're most known for because the clients come in, we help them fix whatever's going on, and they walk out a different person. Occupational therapy, we've seen some great things happen with that. And the medical fitness side for especially all of our folks with developmental disabilities. My own son, who was recovering from knee surgery, and to see him wanting to come and work out and to see the growth that's happening with him, how he's getting fitter, how he's learning how to eat healthier and how to live healthier, and how that's going to have him have a longer, happier life.
Focused areas are neurology. We also do some community health work, especially those with medical conditions such as diabetes or heart disease, and individuals with physical or intellectual disabilities. And then we do have a really focused product line where we work directly with individuals with chronic disabilities, perhaps from birth or somewhere along their life they've encountered a disability, and individuals that perhaps live in group homes or assisted care.
Speech therapy, OT, physical therapy, adaptive exercise, anything that people need in that realm, we're able to provide for them, and they're leaving happier and healthier than when they came in.
The reason why I am excited to keep this going another 10 plus years are the people that we serve and seeing their success stories. That's my purpose, that's my why.
When Don first came here, he had terrible pain in his back. And he's had that off and on because with his stroke, he walks very asymmetrically. And so that just predisposes him to back pain. The therapists here helped him with his pain and then gave him exercises and stretches and things to do to keep him from slipping into that again.
I needed further help, and they were able to provide it. And I'm amazed at where I'm at today.
It's amazing, actually, what I dreamed, it has really come to reality here at ExercisAbilities. It's incredibly amazing that we've made it 10 years and we've come as far as we have and as much growth as we have. And very excited about our impact that we have made through the 10 years. Where we're going is formally creating an all-access clinic where individuals of all abilities can access this long-term and not be held back by any financial barriers. And we're gonna make it happen. We're gonna create this space We're gonna get staff on board and volunteers, professional volunteers, students in training to come and make sure that we do not have people waiting for care, that everybody can get the care that they desire and meet their goals. And our biggest obstacle is overcoming the financial barriers to making sure that all individuals can have access.
And that's where our donors are so important. Those scholarships and that additional funding to fill in that gap so someone's not having to sit home because they can't afford to get the help they need. Our donors make that happen for them. It's just crucial that everybody gets the services they need. No one should have to sit home and be in pain and be without care because they can't afford care.
I'm convinced that ExercisAbilities has kept him out of the hospital or a nursing home.
I'm highly motivated because the alternative scares the daylights out of me, that I'll just slow down and can't do anymore. And I've got people I want to see and places I want to go. And I'm so grateful.
We want everybody to reach our mission, which should be their life mission of being happy, healthy, and independent.